Call it what you want, a plateau, a leveling.
And it's been pretty flat.
That's what the Seattle City Council heard and what hospitals in the Northwest Healthcare Response Network are reporting when it comes to the number of COVID-19 patients they're handling.
Although we are still at the plateau, we haven't seen a decrease in the actual number of COVID-19 patients, but the hospitals are able to manage the current level of surge.
By comparison, this graphic by the UW Health metric scientists projects the hospital needs of the United States. In Washington state, it's much better. Of the 5,000 hospital beds statewide, roughly 30% are going to COVID-19 patients, and predictions are it won't get much higher. Of the 400 intensive care units statewide, 70% are being used for both COVID and non-COVID patients. For the 4 University of Washington hospitals, 30% of the ICU beds are for COVID patients.
For us internally, that's been relatively consistent, but the good thing is it hasn't increased.
It's this kind of information that led to the governor's decision to send the Army Field Hospital at CenturyLink packing, and why the 140-bed quarantine center in Shoreline geared to handle hospital overflows is still waiting to accept patients. A big reason for hospital capacity, the canceling of elective surgeries that require a hospital stay.
But by decreasing those elective and non-urgent surgeries, we've cut our surgical volumes probably by 50%. And so the overall capacity within the hospital has gone down.
While the words flat and plateau are being used, hospitals are still waiting to see a decrease.
There's good cautious optimism right now, but we can't let our guard down.
Healthcare workers testing positive for COVID-19, and it's happening tonight at a North Seattle hospital. KOMO's Joel Marino's live with the outbreak affecting 14 hospital workers. Joel?
Mary, these are nurses and therapists and others who work at Northwest Medical Center. And I'm told this is the largest single outbreak among UW Medicine staff so far. The first COVID-19 cases at Northwest Medical Center started showing up earlier this month. The staff who are getting sick all work in a former medical surgical unit that has since been converted to serve patients who don't have COVID-19. How the virus took hold still isn't known, but hospital officials believe it passed from one staff member to the next, most likely when they sat in employee break rooms. The hospital's medical director says no patients were infected. Beginning April 6th, all workers on that floor underwent testing. And for the past 2 weeks, all newly admitted patients are also checked. The unit has since undergone deep cleaning, and break rooms have strict occupancy limits. All 14 nurses and therapists who got sick are now home recovering and said to be in stable condition.
A big question today is, when am I getting my money? You may already have the money in your bank account, or you may not see it for weeks, but the IRS says there is a way to track that money.
This man asked, I was wondering when the extra $600 per week for unemployment benefits is going to start being paid out. Some good news. The IRS says the coronavirus stimulus checks have started being deposited into people's bank accounts, saying on Twitter this weekend, we know many people are anxious to get their payments. We'll continue issuing them as fast as we can. Officials say 80 million Americans will receive their direct deposit this Wednesday. If you want to track your payment, this week the IRS will be launching a portal on its website for you to check. But just note, the people getting theirs first are the ones who filed tax returns in 2018 or 2019 and got money through direct deposit. We also got these questions about flu and pneumonia shots and if they affect COVID-19 symptoms. This man asks a question. Is any data available concerning whether individuals who have had flu and/or pneumonia shots and who contract COVID seem to get milder symptoms? Dr. Elizabeth Mead from Swedish says the virus is still so new.
It's unlikely that getting a flu shot or a pneumonia shot would specifically protect you from coronavirus because the antibodies are quite different. But what we do know is that it's possible to get more than one infection at once. And so protecting yourself from all the other things that we normally worry about not only helps you avoid those infections, but also avoid potential coronavirus and flu, let's say, at the same time, which can be very, very dangerous.